Medicare is a government health insurance program for seniors and people with disabilities. Medicare coverage is broken up into different parts. Medicare Part A is hospital insurance and pays for your medical care when you are staying in a hospital. Medicare Part B is medical insurance and pays for visits to your doctor, lab tests, scans, medical equipment, and IV chemotherapy. Parts A and B together are called Original Medicare. Medicare Part D is prescription drug coverage. Part C plans, also called Medicare Advantage plans, are sold by private insurance companies. They are an alternative to Original Medicare and include services covered under Parts A and B. Many Part C plans also cover prescription drugs. If you have Original Medicare or a Part C plan without prescription drug coverage, you may want to consider buying a Part D plan if you want coverage for the cost of your prescription drugs. Part D plans are sold by private insurance companies. What you pay each month for a Part D plan is called your premium. Your Part D monthly premium will depend on the plan you choose and your income level. Part D has a yearly deductible, which is an amount you pay first before the plan starts to pay anything for your prescription drugs. After you pay the deductible, Medicare pays 75% of your drug costs and you pay 25%. What you pay is called your out-of-pocket costs, because you pay for them out of your own pocket. Out-of-pocket costs do not include your monthly premium. When your out-of-pocket drug costs reach a certain amount, Medicare will cover 95% of your drug costs for the rest of the year. There are some additional terms that are helpful to understand about prescription drug coverage. Brand name drugs are prescription drugs with a specific name from the company that sells the drug. Generic drugs are prescription drugs that contain the same chemical substance as a brand name drug. Specialty drugs are prescription drugs that have a high cost, are very complex, or require special handling, called high touch. Many drugs for cancer are considered specialty drugs. The formulary is a list of drugs covered by a particular plan. The formulary is usually broken down into different tiers or levels. The tier of the drugs that you are taking will determine how much you have to pay for that drug. You should make sure that the plan you choose covers the prescription drugs that you take. You should also ask if the plan requires that you get your drugs from a certain pharmacy. And does the plan charge you less if you use a mail-order pharmacy? It is important to sign up for a Part D plan when you are first eligible for Medicare, or you will pay a lifetime penalty fee if you decide to sign up for a Part D plan in the future. If you have other health insurance coverage, like from an employer, you may be able to wait to sign up for a Part D plan without paying a penalty. You do have the opportunity to change your Part D plan every year in the fall. During this annual open enrollment period, you can switch Part D plans offered by the same company or switch to a Part D plan offered by another company. It is helpful to review your options each year to make sure that the plan you pick will meet your needs for the year ahead. There are many programs to help you pay for your drug costs. If you are eligible based on your income and resources, the Medicare Extra Help program will pay for your Part D premiums, deductibles, and coinsurance amounts. This program is also called the Low Income Subsidy. If you don't qualify for Extra Help, your state may have a state pharmaceutical assistance program to help pay for your Part D premiums or drug costs. For a list of these state programs or other help with Medicare, call 800-MEDICARE or visit Medicare.gov. Medicaid is another government health insurance program for people who have low incomes and resources. If you qualify for both Medicare and Medicaid, Medicaid can help lower your out-of-pocket costs for prescription drugs. There are also organizations that provide financial assistance to help with your expenses. For more information about Medicare and other topics, visit triagecancer.org and cancerfinances.org.